Good afternoon, friends. I'm Dr. Aajay Shah, and we are bringing this another Facebook Live. I also have another great news to share with all of you. We are crossing our 20,000 mark of our followers, 20,000. And thanks to Hannah, I think we have grown to 20,000 in almost 5.5, 6 months. So, it's a great feeling that everybody is joining this movement and we are getting a great support from everybody. We're also on YouTube channel, so that's been a great success also. And again, I believe this is like a team. We are working together. I'm an equal team player to all of what you are. We learn from each other. We teach each other. We look up what needs to be done. We share, and we obviously ourselves make a progress. So thanks again for reaching 20,000 goal in 5 months. Today on this live, I'm bringing a special guest, actually. I'm bringing a guest who I know for many years. She's an accomplished individual as a mom, as a spouse, a very successful pharmaceutical representative who is very kind, very hardworking, very intelligent, and definitely a great friend. And so let's welcome Jessie Dietz. She's on Facebook Live with us. Welcome, Jessie.
Hi, thank you for having me. 20,000 is a really big deal.
Yeah, thank you. So let's start with saying, where do you live? What kind of work you do? And tell me a little bit about your family.
So I I live in Jackson, Michigan. I work in a very large territory of Michigan. So driving about 4,000 miles a month, or did before we had to go home for a while. I work as a pharmaceutical representative, as you said, for Novartis. So I work with heart failure, which is near and dear to my heart because I lost my father to that when he was only 64. And I live, as I said, in Jackson. My husband and 3 children, a 4-year-old, a 6-year-old, and a 13-year-old. So very, very busy ages, to say the least.
No, I think that's what I absolutely admire about you, because whenever I see you, not only you are always very energetic, always smiling, always kind, always always very mannerful in terms of not to push the product you have, but push the science so all the doctors get knowledgeable. And that's what I like about you, that balancing, as a mom, as a spouse, as a full-time worker, as a friend, all those things are very hard. So tell me, where did you grow up and who influenced you in your childhood?
I actually grew up in Jackson, so here I still am. I haven't gone far, even closer than probably should be. There's a house that is 1 block in front of my house. That's a very old historical farmhouse, and that's where I came home as a newborn. And now I am in the neighborhood 1 block away from the house I was brought home to. So life just comes full circle many times, as it did for us. And my biggest influence growing up was actually my grandmother. She just had that voice that when you heard her talk, it sounded like she was singing. There was always room at her table for anyone, and there was enough food that you probably should have gone and found more people. And she sent you a card for anything that happened in your life. If you bought a new car, you would get a card in the mail from her. So she was a very thoughtful individual. She really cared about everyone that was around her. And that happiness that was even in her voice, it was infectious. So she was my biggest influence in my childhood, for sure.
I think you definitely have taken up after her, because you have the same qualities. And I think those qualities are the best qualities as a human being. I think.
Well, thank you.
Talk about, getting big degrees, making a lot of money. But I think at the end of the day, if you are a good human being, I think that's won the life. And I think
that's for sure my biggest goal. But I also hoard wrapping paper and boxes like she did.
That's interesting. So, and which college did you go to, and who influenced you in the college? What led to this job, what you have right now?
Well, that's a very interesting path. I went to Siena Heights University, which is a small Catholic school in Adrian, Michigan. I started college at Western Michigan in Kalamazoo as an aviation major. I started flying airplanes when I was 15. So before I was driving cars, I was flying airplanes. And I got a full ride scholarship because A, I was a female, and B, I already knew how to fly a plane. So I got a full ride scholarship. Of course, I also did well in school. So I looked valuable to them. But within the first year, I realized really quickly that that was not my calling. It's something I love to do, but it wasn't something that I wanted to have to do. I think there's a very big distinction between those things. And I started studying business instead, which again, I really didn't know where I was going to go with that. And before I knew it, a friend of mine actually somehow got enough of my information that she filled out probably 99% of the paperwork for me to go to her university. And I got an acceptance letter saying, welcome to our university. So I ended up going there, and my major was fine art. I actually have my degree in fine art with a concentration in sculpture. So I just try to say I at least stayed with the A's. I went from aviation to art. And here I am talking science every day instead. So right after school, I went into sales, actually. It was just, I love communicating. It's just something that I really love. And that was part of why I didn't want to go into aviation, because I would miss human connection. You're stuck in a cockpit with one other person for very long periods of time. And that wouldn't have worked well for me. I knew that would have been a soul sucker. So I went into sales just because it was something that was available right after college, and then ended up in a different sales position, worked for Disney for a while and did sales with them here in Michigan. And I got a call one day that said, we have a manager coming to your area for this job. Would you be interested? And I thought, I don't know, when life opens a door for you, you should always at least peek your head through. It doesn't mean you have to walk through. So I said, sure, let's sit down and talk. And he was much like what you're describing me. So thank you. He was a very kind, humble, science-oriented person. And I thought, you were the kind of person that I could and would work with. So let's do this. So that's kind of how I got here. It's a very roundabout way, right? Aviation, art to pharmaceuticals. The greatest influence in college was actually probably my sculpture professor. I, again, was the only female sculpture with that kind of focus. All the other women were in drawing or painting or one of the other concentrations. So it was just me as the only female, and he just treated me with respect and always expected the same of me as everyone else. I wasn't treated any differently. I really appreciated that. He was very kind. He would give you all of the resources, but one of my favorite things that he ever said to me was, I will tell you anything you ever want to know once. If you don't write it down or remember it or do something with it, that's on you. That's not on me. And I just took that to heart, and I've always kind of moved through life with that of, you really need to pay attention to what people are offering you and not rely on them to keep giving it back. Like once they've given you that gift of knowledge or gift of whatever, you should really do something with that. So he was definitely my greatest influence.
No, I think, obviously I knew you, but now knowing, more details of how you grew up and how you went to college, it only impresses me that, a person like you, I always thought were very intelligent, very kind, very people person, went from aviation to fine arts and sculpture. And I think that proves that a person who is willing to work hard, work smart, listen to people, and be very streetwise, can be successful in any field he or she chooses. So I think, you are, in my opinion, you are one of the top representative I've ever seen. You're never a pusher like some of people are. You always bring the science. You're always mannerful. You always wait when I'm busy. And I think those qualities are, in my opinion, more required to be successful than any other brain or any other knowledge you have. So I think
Right.
It's a big feeling. So
I really appreciate that you say that. It's always been my goal in my life to be a resource I just want to be resourceful and be able to bring something to the table. Is when I don't have something of value, that's when I start questioning where I'm at. So
No, I think I agree with your sentiment that, and to be honest with you, those qualities actually translate not just as a worker, but it translates as a mom or a spouse or a daughter or a friend, that we
yeah,
always try to bring the resources to the every person we meet. It just doesn't apply only to our work. And I try to be the same person, that I try to bring resource not just to my job, but also to my family, to my friends, to my community, even the whole world. I think that's a key thing, that we have to be, a resourceful person for everyone we meet. So that, I think you embodies that very well.
yeah,
Let me ask you a kind of a personal question. Share whatever
yeah.
you is that, tell us about your health history as much as you want to tell us, and see where you were 5, 10 years ago, and then we'll talk how you have changed that. So tell us where you
Sure.
were 5 years ago.
So my doctor, my internal medicine doctor, actually has said to me a couple times, he said, you're the interesting patient, and none of us really want the interesting patient. I know him very well. He's very sarcastic as I can be, so he was totally fine in saying that to me. But based on the things that, looking back, it's like, wow, yeah, those things are very interesting. I grew up in not a wonderful scenario. I was actually sexually abused from the age of 3 to 18. In that time, had a lot of other medical things, but I think when your body has that kind of trauma, I think your body starts reacting in a traumatic way. So I've had some really interesting medical. I was asked one time if they could put me in a medical dictionary because it was so unusual. But I have had 9 cysts removed. So I have had cysts that kind of just have always developed all over. I had a dermoid cyst, someone that actually had hair, teeth, and skin that had formed inside of it that was a grapefruit size on my ovary. When they went in to take that cyst out, my appendix had actually ruptured and fallen behind it, and I didn't know till they were in surgery. I actually have a cyst still in my pineal gland in my brain, so just check on that one every once in a while. I had my uvula removed when I was 18 because I was choking on it. Flash forward, it was sleep apnea, but back then they didn't know that's what it was. So had to have that removed, and had suffered infertility for quite a while. We were the family, though, that adopted, and then 6 days after finalizing the adoption, found out we were pregnant. So that's why we have 2 little ones that are the same age. So it's been a journey. And then now I found out within the last, I think it's just over a year, I actually have a couple autoimmune issues, diseases. I have autoimmune neutropenia, which is quite rare, but the way I found out, again, life just works in miraculous ways. Sometimes I give blood regularly. My father always did, and I just always felt strongly that if you have extra pieces that you don't need, you should just give them to someone that needs them. So I was actually asked if I would donate platelets from the Red Cross. And I was like, sure, take it. If you need a kidney, you can have that too. Well, I went to give platelets and it didn't go well, but I ended up getting a letter back from them anyway that said, please, thank you for your donation. Basically, please don't ever do it again. You cannot give platelets, plasma, or organ donation because you have H and A antibodies, which I was already aware that I had ANA, so the autoimmune antibodies, but no one could really figure out what it was that was going on, and all the issues that kept popping up just seemed very random, and it was hard to connect them. But then once they sent me that letter, we looked into what that meant, and it's an antibody formed by this neutropenia. So if someone else who was very sick ended up with my antibodies, they would not recover from it. So it made sense now that I will get sick, and when I get sick, I get very sick and for longer and much worse than someone else probably would, because my neutrophils will attack each other rather than going after whatever virus or bacteria is there. So it's been a it's been a history, we'll say.
No, I think, to be honest with you, listening to you now, I wouldn't have never guessed what you went through and you're still going through. I think, and that again is a testament that 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 a person who is willing to work hard, work smart, can overcome many, not just health and medical issues, but also any other issues too. Because not only as
Yes.
a child you have to suffer, certain aspect of life, but as an adult, you also went through a lot of health issues. So I think, I mean, you are a winner, to be honest with you. I've not seen many people who have gone through what you have gone through and be still smiling and, pushing hard and working as a mom, as a spouse. I mean, all those things are very commendable. And I think, to be honest with you, I'm actually very honored to have you as our guest because your story will motivate so many women who are going through right now hardship in life, particularly with COVID-19, that
Yeah.
how to be strong, how to overcome any issues in life, and keep smiling and keep motivating family and spouse and kids and parents. And so I think I really appreciate you coming on and sharing with us. So
Well,
tell
thank
me
you.
that how did you make changes to your health lifestyle? What did you read about how to change? Did you follow any authors? And what changes you have made so far?
So one of the things that changed the most, I think, um, as I said, we were going through some infertility issues, and the medications that I was on, I gained 40 pounds in 2 months. My body was not handling the medications well. It was very obvious. My mood was changing. I mean, given they're supposed to change your hormones and everything, so they were doing sort of what they were there to do, but my body was very clearly saying no, thank you. So um, after that, it was very hard. Well, and then we went through the adoption process, which was a very interesting one for us because we're never on a list. There was no list of waiting. We were actually wanted to be foster parents, and while we were going through that process, I met a couple at a coffee shop, and 3 months later, we adopted their baby. So there was that, which brings on a lot of anxiety. So there was no time to switch from this new body that I had to really being more health conscious, really, because I had new stress as to what this new journey that we were on. And I think anyone can attest to stress does not do magical things for your body. It really can bring you down, not up. So there was that. And then as we had this newborn baby who had colic terribly, there were sleepless nights, and lack of sleep does not do anything good for your body. And there was very poor eating habits. I don't even remember what they were. It was, what can you put together quickly with a baby that's very, very demanding? And then we find out I was pregnant. And the greatest thing that happened to me during the pregnancy, and you're going to think this is maybe bizarre to say this, I had gestational diabetes. And the reason I say that that was a really great thing for me was I had to go see an endocrinologist who just rocked my world on eating correctly. We went through what I was eating, and he was like, well, you have so many meals with no carbs, knock it off. And I was like, what? He's like, and you're not eating enough. You need to eat more, way more than you're eating. I'm like, but all the magazines say basically starve yourself, never eat again, and you'll lose weight. He was like, no. He was like, I tell so many, he namely suggested truck drivers that are diabetic that he's like, they'll go so long without eating and then have like nutritionless meals. And I have to tell them, you need to eat more regularly, and you need to have a good balance of carb and healthy fats and protein. You really your diet should include those things. You need to stop eliminating those things. So I was dumbfounded, and I just followed his rules. And in that pregnancy, I gained 9 pounds, which really meant my body was losing weight. I was shedding weight elsewhere. The baby was very healthy, but I was losing weight in the areas that the weight was not needed and gaining weight in the right areas. So it was a very big life lesson on finding the right people to listen to. The magazines that tell you that you should just follow some Hollywood diet. That's not the answer. And then after that, as I said, I lost my dad to heart failure, and he said to me around the same time, Jessie, I really want you to make changes to your diet that you can stick with now. Because if you get to be 55 and your doctor looks at you and says, change everything you know about food, you're going to fail. And that hit me so hard because I saw how unhealthy he was and couldn't imagine having a physician tell me that one day, like, hey, everything you know about food, I need you to change it all right this minute. Because as we all have probably came up to a point in our lives where we do try to make drastic changes and we fail, and then we kind of give up because it was so hard to make a complete turnabout. So for me, I post-pregnancy did definitely gain weight again right after her, and it was really hard to kind of figure out why. Again, there was lack of sleep, there was stress, there was a lot of different factors, but I started looking at what changes can I make that I can maintain and not try to do a 100% change today. So in the beginning, I tried to do, and I'm going to say things that for some of you, like, it is totally different. A keto diet does not work for me. That is not something that my body responds to. I tried it. And when I tried these things, it was for a long period of time. I went gluten-free and pescatarian. So I was only eating fish was my only meat, and I was gluten-free for just under a year. I had a physical trainer. My body did not respond to it. Nothing. My physical trainer was even like, I don't understand. Like, nothing is happening to you. I wasn't in poor health and I was very strong, but I couldn't lose weight. And so I just kept changing things. Then the autoimmune thing came up. And once I learned about food and inflammation, and autoimmune has so much to do with inflammation. So I took a test to find out what foods I'm super sensitive to, and I eliminated them from my diet. And then I always have fasted for 13 years now. I have fasted, and it was always a spiritual fast that I would do in the beginning of the year. But I also would read about the physiology of it and what kind of things that was benefiting in my body and how long it was safe to do it. And once I found out that my body was getting all this inflammation from super common things, I'm not supposed to have olive oil. I'm not supposed to have ginger, rosemary. So things that could just be embedded. If we go to a restaurant, you just don't know what oil they used. And I've never wanted to be the person that's like, I have this list, can you avoid it all? So I fast to help my body rid itself of all of those things. And now that I've combined the elimination of things that cause me inflammation, and I fast monthly now, my body has transformed in ways that I couldn't have imagined. Actually, I've lost a total of 40 pounds in roughly a year from making those changes.
I mean, that's an absolutely impressive journey you have gone through. I think a lot of us, as a physician, I understand, but a lot of people don't realize that they have so much of their own power to change themselves. And I think many times everyone requires a mentor, everyone requires a coach, everyone requires somebody who is more knowledgeable. And that's what I strongly advise our followers, my patients, to reach out to an expert. Don't try to read from a journal, or don't try to read from a magazine or something, but reach out to an expert, because not only you had a good physicians, you also followed advice of the people who actually were your best well-wishers. And I think our page try to do that. We try to give evidence-based advice, like in terms of keto diet. I personally don't recommend keto diet, but I'm not so strong of telling people that keto diet is necessarily bad or good. I think the science is still out there. Jury is not out yet, and I think time will tell. But I agree, some people may do well on keto. Most people don't do well on keto. So I think, but I want to hear more about your fasting. Like, how long would you fast? And then when you fasted, was it water only fast? And what was the longest duration of fast you had?
So I started fasting, as I said, about 13 years ago, and it was very spiritual based at the time. I had a very close friend of mine who knew I was just kind of in a really ugly place emotionally, and she suggested that I do a 1-day fast. Well, I was also nursing a baby, and I thought, no, you absolutely can't do that. Well, she, again, spiritual based, said, like, oh, you don't think God realizes you're nursing a baby and would stop? And I was like, okay, that's fair. So I did a 1-day fast. I ended up reading a book that weekend, titled Fasting by Franklin Jensen, or Jensen Franklin. I always get that backwards. He wrote this book about fasting. And after I read it, I thought, tomorrow I'm going to fast for 40 days. I had fasted for one. So I actually started fasting, and I fasted for 18 days. It was water and juice. I think with my first fast, I did probably juices I would never do again. So like, basically it wasn't juice. It was what they, the juice cocktail. It's like something sugar with water. So I was doing that for 18 days. I will say, of all the fasts that I've done in those 13 years, that was probably the most significant for me ever. I learned things about what food does to your body and your relationship with food, that it is very much an addiction. The things that you miss about eating, I miss chewing food. My body wasn't lacking calories. Like, I was very aware of making sure that I had caloric intake with the juice. It was chewing that I missed, just like I think with smokers, like it's the action of smoking. So very much physical addiction. I learned that food holds a lot of power over your emotions. As we know, depression is very chemical, and quite possibly anxiety is too. So food is chemical. And when you void your system of those things, it's almost like your depression or anxiety doesn't have a host anymore. It really doesn't have as much to latch onto. So I would maybe feel it in my mind, like I was aware of it being there, but I wouldn't have the physical reactions to it that I did before. So really, and I think I've told you this before too, that it's almost like I reverted to being, and I laugh at myself for saying this, but almost like a baby, where babies kind of know it's time, like, okay, I need calories now. Like, it's time to eat now. I learned that about myself again, like, okay, I need juice now. It was really just my body saying, like, okay, it's time to give me something to work off of, instead of a boredom of grabbing something nearby or just wanting popcorn or something. Your body starts to communicate with you again. And I think that it was significant that it was an 18-day fast. So it was a lengthy one. It wasn't my longest. I did do a 40-day fast, same thing, water and juice. The only water fast I've ever done, the longest, was 3 days. I will say that was the hardest I've ever done. Very, very tired. If I could have slept for the 72 hours, I'd been fine. But with a job and 3 kids, you don't get to sleep for 72 hours. You barely sleep for 8. So yeah, that was kind of my journey of getting me into fasting. And then when I realized I had these health concerns, it was actually a therapist of mine that said, you fasted for years. Have you ever thought of doing that more often? And I thought, no. I would do fasting reactionary to if I knew I was having a lot of anxiety or depression, which I've suffered with for years. I would react with fasting because I knew I could remove myself from being its host. But I never did it proactively. And it made so much sense to me when she said that. And my internal med doctor years ago would never support me fasting. He was actually very angry at me for doing it because they didn't know as much about it. Well, I said to him again, I feel like I need to say this to you because, we have an open communication with everything going on. I'm going to start fasting regularly, like on a monthly basis. And I've chosen between 4 and 7 days. And he looked at me and he was like, I wish I had the power to do the same. I was like, oh, okay. So it's out there. So it's been It will be a year in October that I have started fasting on a monthly basis.
I think I literally like the way you described it. I think obviously fasting has many benefits for people with chronic disease like diabetes, obesity, hypertension, but we don't realize that even healthy people, when they proactively fast, there are significant amount of benefits. And I think not in just terms of longevity, but also prevention of certain cancers. It's a concept of this autophagy, where when you start fasting, your precancerous cells gets killed and gets digested. And I think so fasting has to be a regular practice, even for healthy people. So I think I like the term proactive fasting instead of reactive fasting, because I think when you want to lose weight, everybody would fast. But when you are at ideal body weight and you have no other health reason to fast, and if you still proactively fast to stay healthy and to live long, I think that's what I would recommend to many people. And I try to do fasting myself. Matter of fact, we have a friend, we have a person we are helping, and she's actually fasting right now, a water only fast. She's retired, so she doesn't have that much physical responsibility.
Mm-hmm.
Water only fast, and she's succeeding so well. The only thing she drinks is a lemon water and some green tea. And
Mm-hmm.
I mean, I commend her, because she has never done fasting in her life before, and she started following our page, and she has lost significant amount of weight. Her
Mm-hmm.
insulin requirement is coming down. She's enjoying. She's reading more about healthy lifestyle. She's watching all the YouTube videos I sent her. She's actually, to be honest with you, she has taken, just like you had taken the charge in your hand, she has taken charge in her hand. And I commend her. Matter of fact, we are bringing her as a guest in about 3 weeks, to
Oh,
show
good.
that at any age you can take charge of your own health and can turn
Yes,
around and be healthy again.
absolutely. And I'll say too, since I have been fasting on a monthly basis, before that, I was very, very, very sick. I had had a seizure. I suddenly was having vertigo, which I'd never had in my life. I got pneumonia twice. I mean, my body just was not handling living very well. And since I've started fasting, I haven't been sick once. My daughter had influenza B, and she's only 4, which hers turned into pneumonia also. And she laid on me and coughed in my face and sweat all over me the whole time, of course, because I'm mom. And my husband kept coming in, and he was like, I'm so worried about you. Like, you are going to get so ill. And I was like, I know, but I was fasting when she was sick. And he was like, you need to eat. I'm really worried that you're fasting when she's so sick and she's on you. And I at first was like, maybe I should. I don't know. But then I remembered food's not always the solution. Sometimes it's the problem. So I researched, should I fast if someone around me is sick or something like that? And I found that when you're fast, you actually start producing a ketone that you will never produce unless fasting. And this ketone specifically is there to ward off any kind of like oncoming virus or bacteria or anything like that. It's a specific goal. And I thought, this is exactly what I need to be doing right now to prevent this. So for 8 days, she had a fever of right around 104, and I never got sick. And here I am months later. I've not had any sickness since I started doing that. Part of my autoimmune is severe dry eye. My eyes are fine now, and I used to wear glasses, and this one will sound bizarre. I don't even wear contacts now. I don't wear glasses or contacts, and I'm fine. So that all has happened since fasting on a monthly basis.
That is absolutely impressive. I think, you are teaching so many of our followers and how to take charge and how to take care of your own health. So let me
Yeah.
ask you the next question. We always discuss about the 6 pillars of healthy lifestyle, and those pillars are healthy eating, typically whole food, plant-based diet,
Mm-hmm.
exercising regularly, sleeping, substance abuse, including alcohol, stress management, and relationship. So tell us how much exercise you do, and what is your advice if somebody wants to start exercising?
I'm going to be sincerely honest with you. My exercising is chasing children.
Typically,
It also includes, because I know I'm at such a deficit of time right now, and we do have a pool, so we spend a lot of time outside in the pool, moving around in there as a family. There's actually every single day that there's been sun, we're out there, so that is one way. But I also just try to make better choices. Like, as you know, I drive a lot and I park a lot, so I choose to park further and walk farther. So I try to just implement some little things throughout my day so that I can spread in healthier choices, like taking the stairs rather than an elevator. So really just making yourself look at what's ahead and how could I add a little bit more to that as far as, exercise. Man, when these kids are a little bit older, I really plan on doing more. I
No,
miss weightlifting. It was always my favorite thing. And interval training. So as soon as I have a little more time on my hands, I will go back to that. But right now I'm either too tired in the early morning or I'm falling asleep by the time I really did go to bed when they went to bed last night.
no, that's an excellent answer. And I think if you look at the people in blue zones who live long and happy and healthy, they live up to 100. They are not necessarily going to gym. They are not necessarily lifting weights or running on a treadmill. They are physically active throughout the day. They do gardening. They play with their kids. They mow the yard. They go out to swim in the ocean or lake. And they're
Hmm.
physically active, more so than just calling it an exercise. And that's the reason, matter of fact, our Society of Lifestyle Medicine doesn't even call it exercise recommendation. We call it physically active. That means
Yeah.
vacuuming the house, even washing the dishes, just doing any kind of physical activity, playing with kids like you do,
Yeah.
parking the car the furthest you can, taking the stairs. And I think those things, as long as you are conscious about it, you can pack in the recommended 150 minutes of exercise per week, even if you're
Yes.
busy. So I think I
Yep.
agree with you that some people are really couch potatoes. That needs to change. But at the same time, even if you are very busy as a mom, as a dad, working full time, commuting 2, 3 hours, driving all day, you still can pack in 150 minutes per week. That means about 20 minutes per day of some kind of physical activity. And matter of
Yes.
fact, the data is very clear. The most benefits of physical activity are seen at just 20 to 30 minutes per day. After that, if you exercise for 2 hours, benefits are not exponentially double or triple. They just only go up slightly. So I advise all my patients, all my followers that plug in 20, 30 minutes a day. I'm not talking going to the gym, just simple walking in the house or walking around the house or doing some kind of yard work or vacuuming the house. So be physically active. So next
Hmm.
question to you is, with all this busy thing going on as a mom, as a spouse, as a pharmaceutical representative, how many hours of sleep you get, and do you catch up on sleeping on weekends?
Um, so my sleep, I really try to, and as I said, I have sleep apnea. So I have to be wise of actually using my CPAP machine also. I will also say I really kind of pulled back on its usage because once I lost so much weight and I did have my uvula removed when I was substantially younger, I don't seem to be having the sleep issues that I was when I was heavier. It was definitely necessary for me. My sleep was very broken. I would count how many times I was waking up by the time I woke up. And that was just when I was aware enough to count, now knowing that it was actually substantially more that I was waking up. So I still will use my CPAP, but I try to get a minimum of 8 hours. I really aim for 9. My husband is really wonderful. He's a very early riser, so he gets up an hour before me to try to get life going and so that I can sleep the extra hour because I'm more active at night and accomplish more. So we just kind of are able to balance each other that way. So he's relaxing at night while I'm still doing house chores and stuff. So my sleep now is about 8 to 9 hours. And on the weekend, the kids are actually more active. And so it's about the same. Every once in a while, I will try to sneak a nap in. And I try to even just limit my naps to being about like 30 minutes if possible, so that it's a restful nap and not one where I feel like I could have slept for the rest of the night.
I think I agree. I think 7 hours to 8, 9, 7 to 9 hours is probably ideal. And I take sleep very seriously, actually, myself. Even though I commute 2 hours, I work full time, I still pack in about 7 hours, 7 hours, 15 minutes every night. My average for last 3 years has been more than 7 hours. So I think I sincerely advise everybody that, if a day, if you are busy with any work related activity or family responsibility, I understand, but try to get 7 hours of sleep, not watch late night TVs or Netflix binge, or at least because sleep
Right.
is as important as exercise. So that brings up the next question. With all this thing going on in your life, personal health, work, family, spouse, being a spouse, how do you manage stress? And do you do any meditation, or do you recommend people any specific tools to manage stress?
Absolutely. So, as I stated, I have a therapist, and I have a therapist based on what my trauma was in my past, but I don't live the trauma anymore. I've had a therapist for over 20 years now, not the same one, but I just strongly advise, like, I mean, even with your job, right? If someone has a cardiac need, don't try to figure it out at home. Find a cardiologist. If you have extreme stress or, worry or depression or whatever, find someone that's their specialty. There's nothing wrong with that. There should be no stigma. So I see mine on a biweekly basis. We always check in with if there's anything new, or if there's any, if I don't need her, she wants me to be honest. But I think that's integral to have someone, even if it's not a therapist, but communication, I think, is key. So someone that you can be open with, someone that you can talk about it all. The more you hold things in, I think that becomes toxic to your body too. So being able to let that out and have a source for that. I do take medication because of my anxiety and depression, but very low dose. And I will probably be on it for life because I think my trauma definitely changed me physically in a way that will be a chemical imbalance moving forward. But I've also learned myself so well that I require very little, and I can kind of preemptively know when something is on the horizon and can make physical choices. I can fast because I always know that breaks the cycle. So I think that in the world that we're in right now, stress is like something that, it's not funny, but when someone used to ask, how are you doing? We used to respond saying good. And now if someone asks how you're doing, our new response is busy. So I am concerned that's where we're at now, but it just says that we're all living kind of a stressful life, and you need to find openness. You need to find someone that can be your sounding board so you don't hold it inside of your body. You need to get it out in some way.
No, I think that's an excellent answer. I think stress is part of life. I call, stress, which we all need in our life. At the same time, getting distress is not necessary. And we all have to figure out a protocol or a plan how we can turn all the distress into eustress. And that
Yeah.
definitely includes regular exercise, regular sleep, seeing a therapist or seeing a counselor, or having a friend or any well-wisher who will lend his or her ears and will guide you through. I think sometimes going to a therapist or a counselor is more appropriate because they're expert on the field. They've gone through school. They've gone through a lot of experience of dealing with the same kind of situation. And your friend may not have the widespread experience what the therapist would have. So I agree.
Right.
Seeing a therapist should never be a taboo or stigma. It should be considered a part of just living. And
Mhm.
to be honest with you, mental disorders in this country and even in the world has been looked at as if it's a sign of weakness, but actually it's not. I think many of us go through those ups and downs of life in terms of mental, and I think we should actually take a pride that we have enough emotions to go through ups and downs, because many people, when they become emotionless, when they become totally apathetic, I think they actually are losing the life more so than people who go through ups and downs. So if I have a
Yeah.
choice, I'd rather go through ups and downs, take care of all the downs, and not go too high. And I think be balanced. So I think I admire that you take help of a counselor and you actually benefit from it. So
Yeah.
my next question is, in this country, a lot of substance abuse happen, a lot of opioid addiction, a lot of alcohol addiction, smoking and nicotine addiction. So do you have any specific advice uh, as a person, who has seen other people go through? I always ask this question to all of our guests because
Yeah.
I believe all 6 pillars are important, and substance abuse is an equally important pillar as much as exercise and sleep.
Absolutely.
So what do you think?
Well, and I actually lost an uncle to alcoholism. So I've watched how serious these things can be. And for me, again, I keep going back to fasting, but it's been such a solution for me. I think when you take a break from those things, I mean, I love coffee. I love coffee. And when I'm fasting, I don't have caffeine to make sure that I'm controlling it and it's not controlling me. So I think putting things in your life that you kind of have your barriers or your bumpers, like if you're gonna go bowling and with a little kid and you need the ball to stay in the center, what are your bumpers going to be that if you've hit a bumper, you've gone too far? And is it a resource like a friend where you can say, hey, I just want to have you there so that if I ever hit this mark, I'm saying it out loud now, I want to reach out to you. Or for my uncle, I think he was a Vietnam War vet, and it's about communication and being open. When you hold things inside, you can self-destruct, and I think that a lot of substance abuse starts there. And we need to be more open with each other about where we're at and reach out for help.
Yeah, I think, see, that brings up the next important pillar. We are expanding our pillars in terms of the top 6 pillars. Uh, I think let's talk a little bit about relationship, because I think everybody on Facebook Live right now is commenting how well this thing is going, and a lot of people are benefiting. So let me ask you the last pillar of the 6th pillar, and then we'll expand to the new pillars which we are trying to go now on. So last pillar is how do you balance all this responsibility for all the relationships you have as a spouse, as a mom, as a family member, as a friend, at work. I mean, all relationships are so important for, living healthy life. How do you balance that? And do you have any specific advice in terms of how to have a great relationship with everyone you meet?
Yes, communicate, 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 communicate. The more open you are, the more you discuss all of the things, the closer you will be, the more bonded you will be. I have had to have some very difficult discussions with my 13-year-old. I just wasn't ready for a 13-year-old boy. I didn't know how many things changed and how quickly that happened. It took me by surprise. But I finally sat him down and I said, you know what? We're going to set aside the first Tuesday of every month. I'm going to come to you. You don't need to come to me. And we're going to discuss what's going on in your life. And we're going to talk about all the things that you might feel ashamed of. I mean, he's 13. He's really dealing with what sexuality means. And he actually thought like he was dirty by having those thoughts. And it was so upsetting to me that I didn't know he felt that way. And it's too much to ask of him to come to me with those concerns because it's embarrassing. So I said, I'm going to come to you on the first Tuesday of every month, and we're going to talk about this stuff so that you know it's coming. And there's going to be months where you say, I don't have anything. And then there's going to be months where you're going to unleash and have so much to talk about. Same thing with, my spouse. It's being very open about where we're at with things. If we feel like, there's areas that we're not being fulfilled, mentally, spiritually, whatever, that we need to come together on that. Friendships is the same. If you feel like, I miss you, tell them. But really, more than that, tell them that you love them all the time. If you're thinking about someone, just reach out and say, I'm thinking about you. Like, we need to know that from one another. It's one thing to have it happening inside of you. It's another to let that person know. And I just think the more that we touch base with each other and the more that we're open and communicate, things just kind of fall into place better, and you maintain healthy relationships by being open.
No, I think that's an excellent answer. I think relationship, I always feel like, is a give and take. Open communication is very important for both parties. Love is very important, and love has to be unconditional love. And I think I'm starting to get actually a theme from you, uh, which all our followers, listeners are going to get the same theme, that you are a very proactive person. You are proactive about fasting. You are proactive about reaching out to your son. You are actually scheduling appointments with him from your side. So instead of waiting until something goes wrong, you're actually becoming proactive. And I think that's a main message of our talk today, that be proactive instead of be a reactive person. And I think that's what I commend you, that you are a very proactive person. So that brings us to our next pillar, which are the pillars which our college has not expanded, but we have expanded unilaterally starting last week. Matter of fact, we have on our Facebook page a new logo, new pillars. We have actually expanded to 14 pillars, which I'll cover in a second. But our next pillar is education. So my question to you is that person with variety of education experiences you have gone through, what is your advice to young girls, and girls who are in high school, college, and even for the women who are actually going through different phases of life, that how can they stay fully educated, and how can they have a lifelong learning experience?
I think one thing, especially with, social media, we see something and it's so easy to take something as face value and be like, oh, I learned this today. But did you? Like, whenever I see something, I try to not really ever take it as face value, but to research it on my own, to look up how factual something is, to maybe learn something extra about it if it is fact-based. So just diving a little deeper, because I think it's very easy to skim the surface in life. And if we just live at the surface, as you were talking about, like the highs and the lows, you'll absolutely miss the deep depths of the sea and how beautiful it is down there. So don't just take what you're given at face value. Dig in at least a little bit more. You don't have to know, a lot about one thing, but know a little about a lot. So just dig in a little bit deeper on all the things that maybe don't even interest you all that much. But if you see something and it clicks with you, just look into it a little bit more and push yourself a little bit harder. It doesn't have to take an hour, kind of like the exercise thing. I don't have an hour right now to sit down and read. I don't remember what that's like, but take just a minute, do something a little extra to learn more about something that's interesting.
I think I agree with you. I think matter of fact, I'm part of one of the group for lifestyle physicians, and I was commenting on our pillars, and one of the physicians actually commented that it has to be a lifelong learning, because in medical field, all physicians have to go through regular continuing medical education on a yearly basis, and we have to do that until we maintain our license. So we are kind of lifelong learner. And I think that applies to every human being. They have to be learning. And I think, and learning doesn't mean that you have to read a book. You can learn from watching YouTube. You can learn from listening to podcasts. You can learn cooking from your spouse. You can learn things from your kids. It just has to be some kind of ongoing brain activity. And there is enough proof, actually. The people who do that, they actually actually many times prevent Alzheimer's disease, dementia.
I was just going to say that because I used to work with Alzheimer's medications. And yes, the more that you can continue learning something new, the more you can put off or prevent Alzheimer's, which I think is fascinating.
So I think, let me ask you last few questions here. I think it's been going great so far. Again, a lot of people are watching. A lot of people will be watching once it's completed. They will be on YouTube by this evening. So we watch again and again. We are going to be doing our second segment on women empowerment, most likely tonight. And I'm very excited about that. So people who have not watched the first segment, it's already on YouTube. Please watch that segment. The next question is, next question is, what are the top 3 books you recommend for anybody to read? Like what you have read, what influenced you?
Yeah. Okay. So the first one, don't laugh, but it's true. The dictionary. The dictionary. I actually used to read it as a child, like early teen, and I would try to learn 3 new words a day. I think it goes back to my desire to communicate the most effectively that I possibly can. And when you understand what all the words that we have access to and learn what they mean, even if you don't know the word itself, but learn what it means, we just have a greater grasp of how to communicate more effectively with one another. You can dive deeper into your communication with people. So I think the dictionary as a book is actually very fascinating. I also, again, because I've talked about my spiritual like background, and it's more biblical based than I would even say like Christian anymore. But I loved the Bible. I read the entire thing in under 2 months. I meant to read it in a year and read the entire thing on my phone while I was sitting in waiting rooms in under 2 months. I just found it fascinating, just even historically. So I think finding a book that kind of pulls at you spiritually, and digging in, and again, like maybe even if it's a overwhelming book like the Bible was for me, take the time to figure it out and work through, regardless of how long it takes to get through it. Because I think we hear snippets throughout life of different things from books like that. And until you actually spend the time to dig in and read cover to cover, you learn different things about it. So that was one of my second favorite books. And then the third, more recently, that I, again, because I don't have time to actually sit down with the book, I did the audio version. But Michelle Obama's Becoming, that was an amazing book to listen to. I love that she actually even reads it, because then you feel that connection, and her belief in her words. And as a female, and just kind of seeing where she went through life to be where she's at, not just on the coattails of her husband by any means, but just what she's done and her belief system. It was a really incredible thing to listen to.
No, I think those are the great recommendations. I think I agree with dictionary completely. I think we all should have habit of whenever any new word comes up, just look up because if you look up the word in the context of reading a paragraph or a page, you have a higher chance of remembering it. So just to carry,
Yes.
and now everybody is a dictionary in their phone. So just look up the word which you don't know the meaning of. And Bible, I agree with you. I think older I get, more I realize that I starting to like Bible or Gita or Quran or any other book, Old Testament, because now I think we have a lot more things to reflect on. I think when I was like 10-year-old, I read a lot of the Hindu scriptures as a story. And I think I enjoyed it. I got fascinated. I liked the historic part. I liked the characters, but I did not have much to reflect on. And now when I read those scriptures, any religion, when I read those scriptures, actually I have so many life examples of my own, which quickly comes to my mind. I reflect on, and I kind of compare myself what the people were going through 5,000, 7,000, 3,000, 2,000 years ago. And I think so now actually those books have become almost like my teacher, my advisor, because I see how they handled their situation, how I handled it, and what was the difference, and how could I do different in the future. I think Bible is an excellent recommendation. And Becoming, I read that book, I listened to that book. Matter of fact, we were flying to Greece, and my wife, I had downloaded to our phone, and we are like 8 or 10 hours of flying. My wife finished going and back and forth the whole book, and she absolutely loved it. And I think Michelle Obama is a star of her own. I think
absolutely.
Obviously, spouse helps, but I think she has gone through Princeton, Harvard. I think coming from a middle class family, and I think she is a new rising star, and I think she can lead so many young people, both African American, white, Hispanics, and she has that charisma too. I think she always appears to me very genuine, very caring, very honest. at the same time, very straight shooter also. I think she speaks her mind and doesn't twist the words, and she's not politically correct most of the time. She says what is the right thing, for everyone. So I think
Yep.
those three are great recommendations. So who are your three top role models? Living or
Yeah, so one is like a group. It's actually my kids. My kids, because they are self-reflections and they are reminders of who I am today and what I'm teaching. And I can see where I'm going wrong even just by really paying attention to them. And I think sometimes that's what a role model is. It's a mirror. It's to who you are. So my kids as a group are actually role models of mine, and they remind me to like embrace uniqueness and differences, and that people aren't cookie cutters. Even if you're all in the same family, we're so far from cookie cutters, and that's okay, and embrace that and learn from that. And then they also just remind me to have more fun and not always just be too much of an adult. I am almost embarrassed to say a couple weekends ago, it was probably 9 o'clock at night, way too late for the little ones to be awake, but we were running throughout the house and I had dinosaur gloves on and I was chasing them all around the house, and the giggles that were coming out of them were intoxicating. And the next morning they were like, can we do that again? And I was like, I don't know, that took a lot out of me, but maybe. So they're actually, they would never guess that I would say that they're role models to me, but they are. And then another one is, or was, my dad. He was just very, very, very wise. And he had like kind of Bible parables all the time that he would say to me. And when he died, I was so concerned that I hadn't written down all of his parables because they were just so profound to me. And when we were sitting in the funeral home and the pastor is asking, if we had any memories about him, like I teared up and said I was really concerned I didn't write down his parables. And then just as quickly as the words came out of my mouth, I realized I didn't need to remember them word for word because I became them in my lifetime and I was living out his parables. So he just will always be my role model, and just giving that wisdom and saying things to people that resonate with them. And then the third is my husband, and he would be surprised I'm saying that too, but he is a very resilient person, and there's not a project that he looks at and says, I can't do it. Like, to the point sometimes I wish he would. He just tackles everything, and I really look up to that because it reminds me to do the same thing in my life, to just not look at it and feel overwhelmed, but look at it and look for solutions at the same time. So those are my three.
I think to be honest with you, this brings the quality of a person you are, because many times when we talk about role models, people forget that you don't have to go out of your house to have role models.
Right.
And kids actually, I mean, that's a big message you are giving. Kids actually can be the biggest role model, because kids, they're honest, they're sincere, they are very loving, they have unconditional love. I mean, all those qualities we actually can learn from our own kids too. And I think father or mother and your spouse, I think those are the key role models in the life, because out of 24 hours we are with them pretty much 16 hours a day. And I think there are other role models from the history, from the past and the current ones, but those role models probably will have some influence on you, but the major influence will be the people you spend time with. So I think your message to our followers and listeners is very good one, that have the role models who are going to be with you pretty much 24/7. So I think excellent answer. But today we really enjoyed. I think, to be honest with you, this will be one of our top live. I think I learned a lot. I think you have a whole book or story to tell. You can probably write a book. That could be even a movie on your life. I think.
Right.
But you are a living star, and really, absolutely thankful to you that you came on.
Thank
This was
you.
just an impromptu. You came to our office and I asked you, would you be on? I said you would love to. And I think this turned into a major production. So I'm so happy and so thankful and so proud of you.
Thank you.
Keep going, and we'll keep working together. And I will always admire you, no matter what role you play. So
thank you. I'm so glad we did this today.
Yes. Thank you again. Yeah.
Thanks.
Yeah. Thank you.